Good afternoon. This webinar offers closed captioning. To enable closed captioning, click on the blue widget or the CC in a box located on the bottom left of your screen. Welcome to the Chicago Vaccine Requirement webinar. This webinar is being recorded and will be made available at youtube.com/ChicagoBACP. Please use the chat box located on the bottom right of your screen to send questions. There will be a Q&A session at the end of the presentation. This webinar will go over some health metrics, the Chicago vaccine requirement, and information for businesses. First up, I would like to introduce Dr. Isaac Ganai with the Chicago Department of Public Health.
Thanks very much. So I'm Isaac Ganai. I'm a medical director in the Chicago Department of Public Health, where I oversee testing and laboratory-based surveillance. I wanted to start just by showing some of the latest numbers about the kind of current status of COVID-19 in Chicago. All of this is public information. Is on the dashboard. I posted the link there at the bottom. And really, this is the best source of information for local data on what is happening with COVID right now in Chicago. And it's a good place to go. I go each day and check what's happening. As you can see, case numbers right now, so case counts, are at the highest they have ever been in Chicago. This is not necessarily a reflection of the highest number of true cases, because very early on in the pandemic, if you remember, there was very little testing available. But certainly we are seeing very high levels of transmission right now in Chicago. And this is driven in part due to the more transmissible variant, the Omicron variant that has spread in the last kind of month or two, but also probably due in part to changing behavior. So people are more out and about, people have been gathering over the holidays, etc. So we're really seeing high levels of transmission in Chicago, and that's corresponding into high levels of hospitalizations and also increasing numbers of deaths. There's not the same kind of relationship between cases and hospitalizations and deaths as there has been previously, thanks to vaccination, because that's kind of starting to break or weaken the link between infection and severe outcomes. Next slide. Despite that, though, you can see here that this is just hospitalizations as a number of kind of COVID people in hospital per 100,000 people in Chicago. And you can see that we're higher now in terms of hospitalizations than we were last winter, when we also had a very big surge in COVID-19 in Chicago. Next slide. But the big difference in terms of kind of the severe outcomes that we're seeing compared to what we saw early on in the pandemic is really vaccination. So even with these kind of more transmissible variants and variants that might evade some of the immune protection that's offered by the immune system, you can see there's a big difference in the number of cases happening between people who are vaccinated and unvaccinated. So people who are fully vaccinated have much, much less likelihood of being infected with COVID-19 compared to people who are unvaccinated. Next slide. So not only do they have a much lower chance of getting infected in the first place with COVID-19 if you're fully vaccinated, you also have a much lower chance of getting hospitalized, getting severe disease. So you can see here in red, this is the COVID-19 hospitalization rate in people who are not vaccinated. And in blue, you can see the COVID-19 hospitalization rate in people who are fully vaccinated. It's much, much lower, and I think the difference has even got bigger since this time. So it's more than 5 times now, the difference between the hospitalization rates between the unvaccinated and the vaccinated. Next slide. And this holds true for deaths as well. So the number of people dying from COVID-19 is much, 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 much lower in people who are fully vaccinated compared to people who are unvaccinated. And really, as a health department and as a city, that's our main focus, is to try and prevent disease, severe disease, and death. And so that's one of the main, this is the main promise of the vaccines. They are reducing the number of infections. They're reducing by very high levels the amount of severe disease and the number of deaths. Next slide. So at the moment, there's many, many ways to get vaccinated across Chicago. Vaccines have been available for well over a year now, and millions and millions of people in the US have been vaccinated. Billions of doses worldwide have been administered, and the vaccines are extremely safe, and as we saw in the slides above, extremely effective. The vaccines are widely available. There's a lot of supply right now. If you're due for your primary series, you can go and get that in many different places. If you need a booster dose, you can go and get that in many, many places. It's available at pharmacies. It's available at healthcare providers, both federally qualified health centers and at private medical providers and at clinics. You can get vaccinated at home through the City of Chicago at home program, and you can also get paid for doing that. You get some money for getting your vaccine doses. There are community events where you can get vaccinated that are often run by the City of Chicago. Chicago Public Schools also has sites for students. And if you need to find vaccine appointments, ZocDoc is good, or there's a dedicated helpline and also a website from the City of Chicago in order to find vaccination doses. So lots and lots of opportunities to get vaccinated, and lots of evidence that getting vaccinated is the key thing in terms of reducing the chance of getting COVID and also the severity of COVID. Thank you. So as part of the definition of fully vaccinated, there are different kind of rules for different vaccinations. So there are 3 vaccines that are primarily in use in the US right now. Those are Pfizer and Moderna. Both of those are what are called mRNA vaccines, and both of those require 2 doses in order to be fully vaccinated. In addition, there is the Johnson & Johnson or Janssen vaccine. That's a single-dose vaccine, so you only need 1 dose of that. For both, to be considered fully vaccinated with either, you need to be 2 weeks beyond completion of the primary series. So that's either 2 weeks beyond the 2nd dose of Pfizer or Moderna, or 2 weeks beyond the single dose of Johnson & Johnson. With all of these, if beyond a certain amount of time, you can now get boosted with another COVID-19 vaccine, and that seems to be really important in terms of protection from Omicron. So people who are both boosted are much, much less likely to get infected and also severe disease with this latest variant that appears to be evading some components of the immune system. So just to clarify again, to be considered fully vaccinated, 2 weeks post completion of the primary series. So that's 2 doses for Pfizer and Moderna, and that's 1 dose for the Johnson & Johnson. Thank you. I think that was all I wanted to say from the health department, and I'll hand over back to BACP.
Thank you, Dr. Gunay. My name is Miguel Campos. I'm a supervisor with the City of Chicago Department of Business Affairs and Consumer Protection. Before we begin, as stated at the beginning by Lisa, there will be a question and answer session at the end of today's presentation. Feel free to type in your questions into the chat box on the side of the WebEx application software. Assuming that this goes as our first 2 webinars did, we may not get an opportunity to answer all of your questions. If your question does not get answered, you may also send an email to bacpoutreach@cityofchicago.org. That email address is at the bottom of this slide, and it'll be on the bottom of each slide going forward. Okay, Lisa, next slide, please. So we are here today to talk about the vaccine requirement that went into effect yesterday at 5 o'clock in the morning. So as of yesterday, Chicago Public Health Order 2021-2, commonly known or referred to as the proof of vaccination in public places, means that any individual 5 years or older will be required to show proof that they are fully vaccinated against COVID-19 in order to dine indoors, visit a gym, or enjoy entertainment venues where food or drinks are being served. Individuals under the age of 5 may still enter an establishment that has a vaccine requirement without displaying proof of vaccination, so long as they are wearing a face mask, except when they're actively eating or drinking, Then children ages 2 and under are not required to wear a mask. At the end of today's presentation, we'll recover the main points of the masking mandate. Both are still in effect. It's not either or. So now there is a mask mandate and a vaccination mandate, depending on the operations that your business is conducting. This public health order is going to remain in effect until the city of Chicago is through this Omicron-driven surge and the risk of overwhelming hospital capacity has passed for the city. Before we move on to the next slide, that is the main reason that this vaccine mandate was instituted. We are attempting to get people vaccinated, and then we feel that that is the safest way to get to drive down the numbers in the current Omicron-driven surge. Next slide, please. These are examples of social media graphics that are available to download by visiting Chicago.gov/COVID. In later slides, I'll go over in detail over other resources that are available at that website. But these are two examples of signage that is available for you to download, print, and place in your place of business, or inclusively if you want to incorporate signage into your social media graphics, whether it's your Facebook page, Instagram page, Twitter pages, etc. So the first one simply says Chicago vaccine requirement. Starting January 3rd, the city of Chicago will require proof of COVID-19 vaccination for certain indoor public places. Valid forms of verification include a valid photo ID for those that are ages 16 and older, plus your vaccination card, a photocopy of the vaccination card, a digital record or mobile application showing your vaccination card, or a printed record from your vaccine provider. So again, proof of vaccination will be required for certain indoor places. These include indoor dining establishments, indoor fitness or gym facilities, indoor entertainment, and recreational venues where food or beverages are being served. And then we'll go into detail as to what is considered a business that may fall into one of the above three categories. Next slide, please. So I stated that we would go into detail. So here's the first one, which would be indoor dining. Our definition of an indoor dining establishment is an establishment where food or beverage is served, including but not limited to a restaurant, a bar, a fast food establishment, a coffee shop, a tasting room, a cafeteria that is open to the public, a food court, dining areas of grocery stores, but not grocery stores themselves, a brewery, a winery, a distillery, a banquet hall, or a hotel ballroom. In later slides, we'll go over exceptions or exemptions to the above. Next slide, please. So an indoor fitness or a gym venue includes, but is not limited to, a gym, a recreational facility, a fitness center, a yoga studio, Pilates studio, cycling, barre, or dance studios, a gym inside a hotel, boxing or kickboxing gyms, fitness boot camps, and other facilities that are used for conducting indoor group fitness classes. One question that we've gotten multiple times already is the following. Are individuals allowed to use a locker room to change clothes without showing proof of vaccination? Our answer is no. All indoor fitness venues must comply with the Chicago vaccine requirement policy, including those utilizing locker room areas to change clothes. Next slide. So I mentioned indoor entertainment and recreational venues where food or beverages are served. Our definition of these includes, but is not limited to, a movie theater, a music and concert venue, a live performance venue, an adult entertainment venue, a commercial event and party venues, a sports arena, performing arts theater, a bowling alley, an arcade, a card room, a family entertainment center, play areas, pool and billiard halls, and other recreational game centers. Next slide, please. And in addition, another portion of Health Order 2021-2 is a vaccine requirement for employees. So all covered entities. So I covered the location. So if you are a gym or fitness venue, an entertainment and recreational venue, or a food establishment, we are asking that all of these businesses comply with OSHA standards 1910.501E and G relating to employee vaccination status and testing, regardless of the number of their employees. Either Elisa or me will type in the website link to the OSHA standards. In essence, all of your employees, if working in one of these covered locations within a covered entity, must either be fully vaccinated or adhere to weekly testing. Specific answers to questions you may have regarding the OSHA standards are contained within the link that we'll post up. So this would be, again, regardless of the number of employees. However, if you are not a covered entity and you have more than 100 employees, then the OSHA standards also apply to you. Next slide. So I mentioned that there are exceptions or exemptions to the proof of vaccination public health order. So the city's order requiring proof of vaccination does not include the following types of locations: a house of worship, a pre-K through 12 school, whether public, parochial, or private, any childcare center, any childcare programs, any locations located within either of our international airports, so that would be O'Hare and Midway, any location in a residential or an office building, the use of which is limited to residents, owners, or tenants of that building. So for example, if we have people who live in condo buildings or condo associations joining us here today, a fitness center located within a residential condo building would not fall under the vaccination mandate. And then the last subcategory are food service establishments that provide only charitable food services, such as soup kitchens. Next slide, please. So in addition to those locations, there are individuals who are exempted from the city's order and do not need to provide proof of vaccination. So any individual that is entering a covered location for less than 10 minutes for the purpose of ordering and carrying out food, making a delivery, or using the restroom. So for those of you who are operating or employees or owners of a fast food establishment, if there is no indoor dining component to your business and you close your dining room and it's simply takeout or delivery, then you do not need to check for vaccination status. Individuals are walking in, placing an order for food, and then taking it and consuming that food off-site. This extends to any meal delivery services such as Grubhub or Uber Eats, businesses of that sort. And then anyone making deliveries, so your produce being delivered or liquor being delivered, etc., it would not apply to them. A non-resident performing artist who does not regularly perform or render services at a covered location, or a non-resident individual accompanying such a performing artist. So this would include a musical act, a theater troupe that's in town to perform or put on a play for a set number of days. So it would not include any artists that are either performing on stage or accompanying staff that is also traveling with that group. A non-resident professional athlete or a non-resident individual accompanying such professional athlete who enters a covered location as part of their regular employment for the purpose of the professional athlete or sports team competition. So if you are a trainer or a nutritionist, a head coach, doctor, or a professional athlete visiting the city in order to partake in your regular form of employment, you would not need to show proof of vaccination in order to enter those facilities. Individuals who have previously received a medical or religious exemption, provided that such patrons provide the covered entity proof of the medical or religious exemption and a COVID-19 test which was administered by a medical professional within the last 72 hours prior to entering a covered location. The medical professional aspect of this exemption is important to keep in mind. Most at-home tests would not qualify as being performed or administered by a medical professional. There are some exemptions if you're participating in a telehealth visit, for example, and then a nurse or nurse practitioner or your doctor is watching you complete the at-home test. An individual 18 years of age or younger who is entering a covered location in order to participate in an activity that is organized or sponsored by a school, the Chicago Park District, an after-school program, a child care program, or other organization as may be authorized by the Chicago Department of Public Health. So this means any of you have children who are participating in extracurricular sports activities or club activities that are organized by the school would, for example, not have to abide by the vaccine mandate. So a 13-year-old participating in an indoor volleyball tournament or game for their school, or a basketball game or indoor soccer tournament would not have to abide by this. And then finally, any individual who is entering a covered location for the purposes of voting in either a municipal, state, or federal election, or pursuant to federal law, anyone who is assisting said voter or observing such election at the covered location. Another question that we've commonly received is the following: what types of food service establishments are not required to comply with the Chicago vaccine requirement? So once again, if you are only offering takeout, delivery, or outdoor dining, and by offering outdoor dining, that means any indoor tables, chairs, or other furnishings normally used by patrons for indoor dining are removed or blocked, then the vaccine mandate does not apply to you. So many of you are operators or employees or managers of fast food establishments. If there is no indoor dining portion that is available for patrons to utilize, then you do not have to comply with the vaccine requirement. If you are your neighborhood McDonald's and the dining room is closed, then you do not need to have someone at the door or the cashier or manager asking for IDs or vaccination status of people who are walking in, placing an order, and walking out. That being said, as stated at the beginning of the presentation, the mask mandate is still in effect for all indoor spaces. So while the vaccination mandate would not apply, all patrons over the age of 2 who are entering most indoor public spaces must still wear a facial cover, and we'll retouch on that before beginning our Q&A today. Next slide. So I keep harping or focusing on indoor dining. So a question that we received is, does the order apply to outdoor dining structures? Our answer is no. The order applies to any part of a covered location with a roof or overhang that is enclosed on at least 3 sides. It does not cover any temporary outdoor structure for multiple parties that has at least 50% of its sides open to allow airflow, nor dining structures for individual parties, such as plastic domes, provided that said individual dining structures have adequate ventilation to allow for air circulation. The past going on close to 2 years now, many of you restaurants and bars have taken advantage of our expanded outdoor dining options, outdoor patio, sidewalk cafes. So anything that's considered outdoor dining area would not have to abide by the vaccine requirement. Another question that we've gotten a lot recently is, who must comply with the Chicago vaccine requirement when a covered premise is being rented out for a wedding or other event? So our answer is commercial and event party venues, as well as hotel and meeting event spaces, must comply with the vaccine requirement policy if food and beverage or beverages are being served. A covered entity, in the interest of efficiency, may allow patrons to provide the prerequisite proof prior to entry, either directly to the covered entity or through an intermediary such as an event planner. So we're leaving it up to you guys to decide what works best for your type of business. Some of you may decide that it is best for you to individually handle the vaccination checks and ID check. Other of you can work out a contract and then have an event planner or wedding planner handle those duties for you. You are at liberty to choose whichever path best serves you, as long as it's written down in the written protocol, which we'll cover shortly. Then a question that we've gotten a lot is, are individuals allowed to use the bathroom without showing proof of vaccination? Our answer is yes. Customers and patrons entering an establishment just to utilize the bathroom do not need to show proof of vaccination. However, they are still required to wear a face mask. I'll second back or reference that a couple slides ago when I mentioned the individuals who are entering a location for less than 10 minutes. So let's say you're a bar and you have an ATM machine inside the bar, and someone's just walking in to use the ATM and then leave. Obviously, you would not need to check their proof of vaccination as they're in there for less than 10 minutes. Next slide. So now I'll cover into the aspects of what you as a business are being asked to follow with the health order. So the first business requirement is that each covered entity shall develop and keep a written record describing a protocol for implementing and enforcing the requirements of the order. Such written record shall be made available for inspection by any city official authorized to enforce this order. So before I go over the guidance and samples that you can see on this slide of this PowerPoint presentation, I would inform you or remind those of you who are not aware that in addition to the Chicago Department of Business Affairs and Consumer Protection, the Police Department, the Department of Buildings, and the Public Health Department are authorized to enforce the vaccination mandate. So I know most of you can't see it on the screen. We have provided guidance or documents for you to view. You can go to Chicago.gov/COVID to look at these documents. The first page on the left has tips for complying with Section 3, which is the written guidance. And then the second page is a template, a bare bones template of what you can compose your written protocol on. So it just has name of business and establishment, address, owner, the name of the individuals checking for proof of vaccination, dates that you had training sessions with your employees, a section where you're describing the method of how you're verifying proof of COVID-19 vaccination, a description of the entrances and locations of where the proof of vaccination is taking place, and then a description or section on where you can where you're posting the required signage, which we'll cover shortly. Many of you were asking for samples of these. Given the large variety of businesses that this vaccination mandate applies to, it is next to impossible to provide a one-size-fits-all policy or protocol that you can all use. There'll be trial and error. Some of you may choose to have security personnel or doorman conduct the proof of vaccination. Other of you may have access to set up something online. So if you're an event venue or a wedding venue or a hotel where you're asking the event planner to provide a list of all guests that will be attending the event or the wedding, I'll use a wedding as an example, and then leaving it up to the event vendor to provide or grab copies of someone's vaccination records, verify that they're vaccinated, verify their IDs, and then just provide that over to the venue. Again, these options may not be suitable to a small mom and pop restaurant in their neighborhoods. You may not have access to the same resources that a multinational corporation might have. Some of you are already have some sort of ID checking protocol going on through your normal course of business. If you're a bar, you're already in the habit of verifying people's IDs in order to verify that they're over the age of 21 in order to enter the location. So to some of you, doing everything all at once might be easier for you. But again, guidance and sample are available by visiting Chicago.gov/COVID. Next slide, please. And then the second requirement that's being made are all covered entities shall prominently post signage at each publicly accessible entrance to a covered location and at least one location inside the covered location that is conspicuously visible, informing patrons of the full vaccination requirement. These signs are also available for download by visiting Chicago.gov/COVID. At the moment, they are available in Spanish and in English. Again, our mask mandate is still in effect. Some of the signage can replace old signage. So rather than having one sign saying masks are required and a second sign stating that vaccination is required, you can combine both into one. The one on the right that you can see on your screen states vaccination and mask required in this section. We've made that available in case you have an indoor component that goes along with your outdoor component. You might have a vaccinated and unvaccinated section of your business. So in addition to these two signs, there are other signs or communication resources that have been made by the city and the health department. Just some informational signs informing people of how they can verify their vaccination if they've lost or misplaced their vaccination card. There's general signs reminding people to be kind, or the reason that we're asked or that a business is asking to see the vaccination records prior to entry, how to verify your vaccination status. And again, those are available in Spanish and English. Eventually, they will also be translated into Arabic, Chinese/Mandarin, and Polish. But again, visiting Chicago.gov/COVID, you can click on a link that has required signage, and depending on which one or both of our current health orders would apply to you, there's signage to assist you in implementing these. By no means should you feel forced or required to utilize the city signs. You are free to make your own signs, something that is going to go along with whatever design or motif you have going on in your business. Perhaps you want something that has your brand name on it. But again, as long as they convey the required information, we're okay with you not using the signage that has been provided for you. Next slide, please. So in addition to the signage that I've mentioned, the city has put together a toolkit for businesses and employees or employers. It contains checklists, helpful flyers, resource links. Those are also available by visiting Chicago.gov/COVID. And again, if I haven't made, I'd like to reiterate the importance of that site. So at that site, you can download the toolkit that's shown on this slide, any vaccination required signage, social media graphics, guidance and protocol for Section 3, the checking proof of vaccination. There is a sample of a compliance plan for your employees. You can register for future Chicago vaccine requirement webinars. You can view the actual language of the public health order. There are links showing you where you can find vaccine in the city. And then in addition to that, there is a frequently asked questions document that is updated every couple of days. The last update occurred earlier this morning. Many of your questions contain answers within it, and then we will continue to update that FAQ document. So this treasure trove of resources that I've mentioned are all available by visiting Chicago.gov/COVID. Next slide, please. I'll quickly go over our mask mandate, which is Health Order 2021-1. It's still in effect. It's been in effect since August 20th of last year. So going on 5 months, or soon to be 5 months. Face coverings must be worn in all indoor public settings, regardless of your vaccination status, except when you are actively eating or drinking at a restaurant, bar, or similar establishment. Certain personal service activities which may require the removal of the facial cover. Examples of these are a beard shave or a facial. And then employees and settings that are not open to the general public may remove their facial covers as long as they're static and maintaining at least 6 feet of social distancing from each other. A common example of this would be cubicles in the general office setting. Next slide. I'll go over quick examples of outdoor settings. Open air stadiums. Again, these are examples with Wrigley Field, Guaranteed Rate Field, Soldier Field, a park, a parking lot, a sidewalk cafe, an outdoor patio, an expanded outdoor dining area, a rooftop or retractable roof, an outdoor tent that has at least 50% of its sides open, an igloo or other one-party enclosure, or any indoor space where 50% or more of a wall can be removed via the opening of said windows, doors, or panels, provided that the dining tables are located within 8 feet of such openings. So in all of these outdoor setting examples, the vaccination mandate would not apply. Next slide. Indoor settings include commercial and residential buildings. Again, this is for the mask mandate, not for the vaccination mandate. A hotel, a recreation, bowling or arcade room, a museum, a personal service facility, a retail store, a performance venue, a movie theater, a hospital, any public transportation, which for us includes any taxis, ride-hail services and livery, so Ubers, Lyft, and then any public transportation, whether it's a CTA bus or train or a metro train. There are specific areas within a hotel that would be a covered location, and the vaccine mandate would apply to that. So I'll provide more clearance on that. If there is a restaurant or event venue located within the hotel, the vaccination mandate would apply to that specific area of the hotel. It would not apply to the individual guest rooms, but it would apply to a tavern or lounge located inside a hotel, any event facility or like a banquet room, meeting room where food or beverages are being offered, or a restaurant or fitness center located within the gym, within the hotel. Next slide. So for the mask mandate, businesses are required to ensure that customers and employees are adhering to the face cover mandate. They're required to notify their customers prior to entry about the face covering mandate. For example, posting signs stating that masks are required for all customers, regardless of vaccination status. That this business requires face covering sign is still available by visiting Chicago.gov/COVID. And in addition, there's dual signs that would cover both the facial cover mandate and the vaccination mandate, should both apply to your place of business. Next slide. So as stated before at the beginning of my portion of the presentation, our hope is that by implementing vaccination mandate, that we can put a stop to the surge of recent positive cases. They seem to be driven by the Omicron variant of the coronavirus. At this moment, the only business restrictions that are being placed on businesses are the mask mandate and the vaccination mandate. We are not instituting or placing any capacity restrictions. There are no social distancing requirements. There are no limit on hours of operation. Many of you who alongside us have endured the pandemic for the past 2 years remember some of these aspects being in place. You being at 25% or 40 or 50% capacity, limiting your hours of operation, having curfews on indoor dining, other issues such as having to provide hand sanitizer or single directional lanes at grocery stores. The city is attempting to not go back to some of those more restrictive issues, and we're hoping that the vaccination mandate stops us from having to go back to some of those stricter restrictions. Next slide. So before we begin with our question and answer session, we'll leave up this page with resources. You can find the vaccinations, the vaccine requirement, mask mandate resources can be found again, Chicago.gov/COVID. All our webinars are recorded and are made available at youtube.com/ChicagoBACP. This webinar itself will be recorded and posted once it has finished. Again, before we begin with the questions, any question that we do not get to or cannot get to, there are currently over 170 attendees here. There are going to be dozens, if not hundreds of questions. Feel free to send questions to bacpoutreach@cityofchicago.org. Before we begin, I will attempt to answer, I hope, many of your questions. Again, we have a FAQ. We have been getting questions repetitively or similar questions. So hopefully I can get to some of them before turning things over to Elisa, who might have specific questions. So one question that we've gotten are about repeat customers. So if a repeat customer has previously shown me their proof of vaccination, do I need to check it again on subsequent visits? So our answer is yes. You should check vaccination status each time. Some of your management or staff might recognize a patron and recall their proof of vaccination. Others may not. So we think it's in your best interest that you check the vaccination status every time. That's with regards to a restaurant or an establishment. Some of you might be a fitness center, and there might be a note as people check in that you check their vaccination status already, and you know that that member is vaccinated. Once they scan their barcode, then you would know that you checked their status already. Again, that'll be up to each individual type of business. We've gotten questions regarding proof of vaccination for employees. So again, it is not required for employees. Unvaccinated employees are required to test weekly. And again, weekly negative COVID-19 test and wearing a mask while interacting with patrons is still mandatory. We are asking through this health order that you all comply with OSHA standards 1910.501E and G, which relate to employee vaccination status. And I will put that link up on our chat box shortly. Again, a house of worship, a grocery store does not include indoor dining section within it, are not required to ask for proof of vaccination. Neither are any pre-K through 12 public, parochial, or private elementary or high schools. Daycares are not required to ask for vaccination status. Again, if you are only offering takeout, delivery, or outdoor dining, you do not need to abide by the vaccine requirement. It does not apply to outdoor dining structures. If a covered premise is being rented out for a wedding or an event, it is up to each individual business to decide if they want to handle the implementation of the vaccination mandate or pass it on to a third party vendor, the event planner, etc. There are going to be businesses that have both an indoor and outdoor portion of their business. So again, the vaccination mandate does not apply to any outdoor portion. If an establishment is being rented out by a house of worship for a religious event, so if you are a hotel and the local church or house of worship is renting out an event space in order to have services every Sunday, you would not have to check vaccination statuses for that location. Again, individuals are allowed to enter, to use the bathroom, place an order, make deliveries if they're there for less than 10 minutes without showing proof of vaccination. Once again, the city's order requiring proof of vaccination is enforceable by the Commissioner of Health, the Commissioner of Business Affairs and Consumer Protection, the Commissioner of Building, and the Chicago Police Superintendent, and that applies to any agents acting on their behalf. Questions we've gotten regards like private staff cafeterias. So a staff cafeteria is not affected. Your staff, if it's an employee-only area, your employees do not meet the definition of a patron if it's not open to the public. So those of you who have large work staffs and you have a break room or a cafeteria where employees take their breaks or eat their lunch or their meals, you do not need to check vaccination status in those areas. So with that being said, I think I answered many commonly asked questions. I will now turn things over to Elisa, who will go through the chat and ask any questions that I may not have already answered.
Thank you so much, Miguel, and thank you as well to Dr. Ganai for providing some health metrics. Please bear with as we sort through the questions. First question is, can we consider band members playing in our bar as employees, finding that a good number of them are unvaccinated members?
So sorry, I was muted. It is going to depend. So there's a built-in exemption for non-resident artists or performers. If the band if the band members reside in Chicago and they typically play at your establishment, then that exemption would not apply to them. You can consider them to be employees. They're there for more than 10 minutes. They're not a patron. So we would ask you that you abide by the OSHA standards, and I'll throw up the link on our chat box in a few seconds.
All right, thank you. Does the wellness center or medical clinic have to require proof of vaccine for participation in movement therapy classes like yoga or dance? And I did already post the OSHA website in the chat box, so I could pull the link and post it again for those who joined later.
Okay, thank you, Elisa, for reposting the OSHA link. If you're a medical facility, you do not need to check for vaccination status. So if it's one-on-one physical therapy, things of that sort, you would not need to check the vaccination status. If you are simply just operating a yoga studio and you have 4 to 5 classes a day, a week, and then anyone can sign up, then in that case, we would consider you a gym or fitness center, and then that aspect you would have to check for vaccination status of the attendees.
Thank you. And I know, Miguel, you already touched on this, but can you clarify the exemption for after-school programs for youth sports?
Yes, so I will read straight out of the health order, then I will expand on it. So any individual that is 18 years of age or younger who enters a covered location or participates in an activity that is organized or sponsored by a school, the Chicago Park District, an after-school program, a child care program, or other organization as authorized by the Chicago Department of Public Health would be exempt from the vaccination order. So those of you who have children and then you don't get home till 6 or 7, if your child is attending an after-school activity that's organized by the school or the park district, or an after-school program, whether they are playing an instrument, participating in an arts program, a sports activity, swimming, basketball, volleyball, indoor baseball, indoor soccer. It does not apply to any of those locations. There is a clear distinction. It has to be an event that is organized or sponsored by the school or the park district or the after-school program. Some of you may have children who participate in traveling sports teams, or there's a travel swim team or a club swim team or club soccer, club baseball, club whatever it might be. In that instance, it would apply, but for any after-school activity or an event that's organized by the actual school, again, whether it's a parochial or private school or public school, grades pre-K through 12, that would not apply to those individuals.
Thank you. Could you please clarify that a dedicated door host is not required to check vaccine documents as long as the bartenders and servers check guests before service?
Correct. And again, that was one of the reasons that we did not want to provide sort of a one-size-fits-all protocol of how you're checking for the vaccination status. You do not need to have a dedicated staff member at the door checking vaccination status. You might find it easier to have your server check, and then if they're not vaccinated, asking somebody to leave, or having the bartender check, or if you're a fast food establishment, you can have the person taking the order at the cash register ask an individual if they're going to be dining in that day. If they are, then you would check their vaccination status at the register. You are free to come up with whatever system works best for you. Some of you might find it easier to have a dedicated staff member do it. If you already have a host or a hostess or a doorman checking IDs at a bar, it might be easier for you to just have that individual go ahead and check the vaccination status as well. But by no means are we mandating that you have a dedicated staff member to address those issues.
Thank you. If food is served but not sold, is that location included? My concern is if a philanthropy cafe serves free meals, would it be exempt?
Yes, so that is one of the exceptions that I covered when I went over a location that is not a covered location. So it would not include a food service establishment that only provides charitable food services. So a philanthropic entity providing meals for the homeless or people in need, such as those operating a soup kitchen, would not have to check vaccination status of the citizens joining them for meals.
I believe you already answered this, but this often comes up. Are restaurants/venues required to track the guest names, vaccination, and date of last vaccine?
So yeah, if they're going to be utilizing indoor dining facilities, you need to verify that that they are fully vaccinated, which as gone over by Dr. Ganai, would be 2 weeks after a 2-dose vaccine. Moderna vaccine or Pfizer vaccine, or 2 weeks after a single dose Johnson & Johnson vaccine. So you would need to verify that that person's fully vaccinated. and then check their ID, but you don't have to track them. You don't have to keep records of them as long as you're checking once. For those of you that have the resources to have some sort of system where people are pre-checking in, you are not required to keep copies of someone's form of identification or their vaccination record.
A question is, how would you suggest to verify that the vaccine record is a valid one? Miguel and Dr. Kanai, I'll have you add to this, but we do have a flyer in the toolkit that is extremely helpful on how to check vaccine records and ways that patrons can show their vaccine record, whether it's a digital copy or through an app. Miguel and Dr. Kanai, anything to add to that about valid vaccine records?
This is Isaac from CDPH. I don't think there's anything that I want to add except to say that there's multiple ways that people can prove their vaccination status. So, you know, there's the CDC card, there's IDPH's Vax Verify portal, there's people's medical records. I don't think there's an expectation that businesses are expected to kind of verify the veracity of every single one, but just to say that there's multiple ways to get there, and it's well explained in the available guidance as to how people can demonstrate their proof of vaccination status.
Great, thank you so much. And we'll add with just a question of, can you provide answers to the group for any questions you can't cover? Like Miguel mentioned, we do have a frequently asked questions document on the COVID website, which is Chicago.gov/COVID. And we do work pretty hard to update that as frequently as these questions come in. So it is a great resource. And if we didn't get a chance to answer your question today, please send us an email at bcpoutreach@cityofchicago.org. We'll do our best to respond to emails as well. And for those who joined, this webinar is made available on our YouTube channel, which is youtube.com/ChicagoVACP. With that, Miguel and Dr. Kanai, thank you so much for joining us today. And thank you to everyone who joined as well. Have a good day.